All right, so I promised you a video on shoulders and shoulder health. Some of you expressed that your shoulders are bothering you when you work out. So again, rule number one is, if the exercise that's prescribed, if the exercise on the video is not working for you, then adjust. You have my permission to adjust it, okay? Don't keep doing it if it's causing you pain. Again, it goes back to the video on lunges. If it's causing joint pain, it's probably not gonna make things better. Most likely it's gonna make things worse, okay? Because joint pain is usually a sign that there's something going on inside the joint. But you can experiment with it, and you can maybe find a version of a shoulder exercise or an exercise that uses the shoulders that works for you. The first secret is to warm your shoulders up. Okay, so take a light weight, and all I want you to do is, the weight's in front of you like this, come up and make kind of a W formation with your arms. So from the side, what I'm doing is I'm pulling my shoulder blades together and I'm rotating backwards as far as I can. I'm coming down, back, back. Brief pause, brief squeeze at the back here, brief squeeze. I'm going to do this about 15 or 20 times, nice and slow, until I feel the shoulders starting to fatigue, and that means that they're warming up. Okay, there's blood in the shoulders now. What I'm doing is I'm warming up the rotator cuffs, the little muscles in the shoulders that help your shoulders move around the shoulder capsule. You want to make sure that they're warm before you dive into any pushing exercise. Pushing exercises can be horizontal pushes or vertical pushes. You can imagine I'm laying down on the ground or a bench with dumbbells, pushing away like this. I'm using a lot of my front deltoid or my front shoulder muscle, which raises my arms up like this. And if I'm doing a shoulder press when I'm standing or sitting, I'm using a lot of my side deltoid muscle, which runs along the side of my shoulder like this. Both of those insert here, by the way, and you may, when experiencing shoulder pain, actually feel it in your arm. That's called referred pain. It's not unusual when you're struggling with your shoulder to feel it down there. So, best to get it assessed, and I always like to have shoulder problems assessed by a physiotherapist. If they're ongoing, strength training, again, probably will not help you. It may harm you. You want to get whatever the problem is fixed first, or made, or reduced or mitigated as much as possible, so that any strength training you do at least doesn't cause more damage, but hopefully is able to actually strengthen the shoulder. Because if your shoulder's damaged, no matter how much strength training you do, you won't get stronger. You'll actually only weaken it. So, when it comes to shoulder motions, what we can do is, like I said, we can do a horizontal press, and we're using our shoulders. That's our chest, but also our shoulders are acting as what are called synergist muscles. They're working with the chest. You can do that with a band, and some of you have bands, no doubt. Right? And so this is a horizontal pressing motion where I'm pushing away from my body at a 90-degree angle to my body. And I can also do vertical pressing motions where I'm pushing away from my body in line with my body. Okay? Both of those use the shoulders. You're going to want to warm the shoulders up for those. Now, if you experience shoulder pain when you're doing a shoulder press like that, what I'm going to recommend is, most people do it with dumbbells, don't have the dumbbells in this position, rotate them forward like this, okay? And see if that makes a difference. What you're doing is you're shifting the load from your side deltoid muscle to your front deltoid muscle. And not only that, when you think about it, is there anything in life that we do where we're pulling our shoulder blades together and we're walking around like this? No, this is an awkward, unusual position. Our shoulder capsules are out of their normal position or alignment. When you do this, you kind of bring yourself back into a more normal posture. Your body's more used to this. It may react better, okay? So things to remember. Warm up. If you're experiencing pain, go get it addressed. If it's ongoing and if all these suggestions I give you don't help, go get it addressed with a physiotherapist, because you want to get the problem fixed so that you can actually strengthen the joint, okay? And then a tip for the shoulder press is rotate the dumbbells in like this and see if that makes a difference. But a really big key is warming up and also listening to your body. Listen to what your body's telling you. I'm going to give you one last suggestion on the shoulder press. Again, this position is very awkward for some, pulling my shoulders, especially if I have tight shoulders, pulling my shoulder blades together. So feel free, give yourself permission to push out in front of you like this when you're doing the shoulder press. Also give yourself permission to just leave the weights on the floor and just use your hands. I'm going to tell you, if you do this for a minute, you're going to feel a burn in your shoulders. Okay? So there's some thoughts for you on how to take care of your shoulders when you're training.